It's the real news. I'm Aaron Mate. We continue to look at the fallout from the House Republican passage of the American Health Care Act, which, if enacted, would repeal the major parts of Obamacare. Joining us is Patty Eakins, who's president of the Pennsylvania Association of Staff Nurses and Allied Professionals. Patty, welcome.
Thank you.
So, some studies that I've seen estimate that the reduction in healthcare spending under this measure is $1 trillion, most of which goes to helping low-income people pay for their healthcare. What do you see as the major impacts of this vote if it manages to become law?
I think there are a lot of major impacts for this bill. One of them, as you said, is that people on the Medicaid expansion, and those are the folks who are the working poor, the people who have the low-wage jobs at McDonald's or maybe at the airport or some other low-wage job who really can't afford health insurance. These are the people who, like 1.4 million of them across the country, have been able to get health insurance, and many of them are going to lose it. In fact, the entire project could lose up to 24 million people completely who will not have any health insurance. The Affordable Care Act really took care of about 40 million people, brought them back onto health insurance. And without a revenue stream that's dependable, hospitals are going to probably close or cut services because these patients will come to the hospital anyway. And the hospitals will start feeling the pinch of low reimbursements again, and they will start having layoffs, and services will be cut back, and it'll be really bad for patients and for the workers.
Yeah, I imagine especially that hospitals that serve low-income patients are going to be even more squeezed because they're going to have less resources and then way more people to deal with.
That's absolutely right. Safety net hospitals in the inner cities are going to be hit hard, but so are many of the rural hospitals all across the country. Many of them, particularly in a state like Pennsylvania, many of those hospitals are the biggest employer, and they have very razor-thin profit margins, and a lot of them are going to be at great risk. You can't just run it's not a charity. You can't run a hospital without a dependable revenue stream, and having that yanked away from them is going to be very difficult. One of the things as nurses that we, as registered nurses, we fight for all the time is to have adequate staffing in the hospital so that you have safe patient care. If nurses have too many patients to take care of, they aren't in the room when something's going bad with the patient or when the patient needs pain medicine or something else. So we believe that this is going to be really bad for staffing as well. Hospitals are going to say, well, we can't afford this. So they're going to either lay off nurses' aides or possibly lay off registered nurses or other kinds of healthcare workers. And that'll be bad for patients as well.
Let's talk about pre-existing conditions. Now, under Obamacare, insurers were barred from denying people coverage based on their medical history. This Republican measure now would roll that back, and its replacement is this concept of high-risk pools. Can you talk about what that would entail?
States will be given the right to allow insurers in their state to get rid of, to not insure people who have pre-existing conditions. It'll be decided on a state-by-state basis, and most insurers, I would imagine, they're given that option, they're going to not insure people with pre-existing conditions. So that's, and that'll be a double whammy for the older people. They say that statistic I read is that 86% of the people between 50 and 65 already have a pre-existing condition. And as you know, older people are already going to be hammered by this new act that they passed because insurers will now be allowed to charge 5 times what they charge to people who are young and healthy. So first you're going to get charged a lot because you're old. Then you're going to get charged even more because if you're old, you probably have a pre-existing condition. And they're going to put you, as you said, in these high-risk pools, but they're not really funded. $8 billion for high-risk pools, it's a drop in the bucket. It's not going to work. I read one thing that's one source that said you need at least 160 billion, and maybe that's not even enough. I mean, look, the whole thing is so upside down, because really the way insurance operates is the more people you have in, especially the more healthy people, the lower the premiums would be. So if you only have healthy people in, and you charge the you charge the people with pre-existing conditions more, they won't be able to afford it. It'll be completely unaffordable. And those people will, of course, because they're older and have pre-existing conditions, they'll land in the hospital anyway, and hospitals will have to take care of them.
Finally, Patty, what kind of response have you heard so far from your union members and the patients that they serve? And as this bill goes to the Senate, what kind of response do you expect going forward?
I think people are really frightened, that they don't know what it means. It's caused, for months now, we've had all this insecurity about what is going to be the ultimate outcome of this. And of course, we do believe that the Senate is not going to pass the bill in this same form. So we still don't know what form all this is going to end up as. The Senate has indicated that they want to start with their own bill. So we just don't know. What we're asking people to do, and what we're doing as a union, is we are now shifting our pressure from Congress people and trying to get them to vote the right way. We're now shifting our pressures onto the senators and encouraging them, pressuring them to do the right thing. I mean, look, the promise came that we were going to have a better Affordable Care Act, and instead that promise has been violated, and they've made it worse. And let me just add too that the way that the Affordable Care Act funded low-income people was by a tax on the wealthy, on the a tax on their investments, plus a tax on their high income. So this bill also just gets rid of all that money, and so it's basically a huge, huge windfall for the top 1%. Are going to get billions of dollars that formerly helped take care of people.
Yeah, in fact, I saw one analyst say that this bill could mark the single biggest transfer of wealth from the poor to the rich in U.S. history.
Yep.
Patty Eakins of the Pennsylvania Association of Staff Nurses and Allied Professionals, thanks so much for joining us.
Thank you.
And thank you for joining us on The Real News.